Hi, and welcome to Group 7's group presentation for Issues in Women's Health. The topic that we will be discussing today is violence in Aboriginal women. As you will soon see, violence affects one's health in many ways. We will go in detail shortly, and we hope you will find this presentation enjoyable and educational. Enjoy. Violence is an extreme form of aggression, and it involves many causes that can range from frustration, violence in the home or neighborhood or community, and it also has possible risks of increased aggression, which may include drinking, substance abuse, as well as possible environmental factors such as heat and overcrowding. Violence against women, however, is similar, however, it refers to violent acts that are primarily committed against women and violent acts that result in harm and suffering of a woman. Therefore, it targets a specific group, so the victim's gender being the exclusive motive. Now, statistics found on the internet prove that 1 in 3 women around the world have been victims of violence, and over 6,000 women are victims of violence, which is about 8% every year in Canada. Violence against Aboriginal women, however, also portrays acts of violence towards women of Aboriginal descent. So, the types of violence may include physical, emotional, mental and/or psychological, as well as sexual.
The prevalence of violence in Aboriginal communities is significantly high. In 2009, almost 67,000 or 13% of all Aboriginal women ages 15 and older who were living in a Canadian province stated that they had been violently victimized. Victims of violence in Aboriginal communities consist mostly of young women, more specifically, women between the ages of 15 and 34, which represent two-thirds or 63% of the female victimized population in Aboriginal communities. Approximately 75% of Aboriginal women who survive a sexual assault in their communities are younger than the age of 18, and 50% of girls are under the age of 14, and another 25% are under the age of 7. There are four main types of abuse that occur commonly in Aboriginal communities. They are physical, financial, emotional, and sexual. The next slide shows the difference in the rates of violence between Aboriginal victims and non-Aboriginal victims. This information was taken from Statistics Canada. Women of Aboriginal descent reported nearly 138,000 incidents or a rate of 279 per thousand violent acts towards them, compared to a rate of only 106 for non-Aboriginal women. They were also 3 times more likely than non-Aboriginal women to report having been a victim of a violent crime. This was true regardless of whether the act occurred by strangers, acquaintances, or within a spousal relationship. Homicide rates were also prevalent in this group at alarming rates. Aboriginal women in Canada between the ages of 25 and 44 are 5 times more likely than other Canadian women in the same age group to die from an act of violence. Between 1997 and 2000, the murder rate for women in Aboriginal communities was 5.4 per 100,000, where women that were non-Aboriginal had a rate of only 0.8 per 100,000. This is almost 7 times higher for Aboriginal women. Intersectionality plays a major role in the lives of women who are from Aboriginal communities. Their oppressed nature in and out of their communities is often caused by racism, sexism, and colonization. Perhaps their feeling of loneliness and isolation caused by colonization targets them to be victims of violence since resource centers and programs for battered Aboriginal women was only recently developed. Also, about 51% of Aboriginal women who were victimized by their partners stated they were in constant fear for their lives, and this may also be a reason as to why they chose not to seek external resources. Aboriginal women are most vulnerable and marginalized in Canadian society. When it comes to social determinants of health, they have the poorest socioeconomic and health status of all Canadians. The Society of Obstetricians and Gynecologists of Canada noted that inequalities in social determinants of health include lower quality housing, poor physical environment, lower educational levels, lower socioeconomic status, fewer employment opportunities, and weaker community infrastructure for women in Aboriginal communities.
Now that we have discussed issues of violence in Aboriginal women and talked about the social determinants that make Aboriginal women more prone to violence, we want to expand and almost flip the topic to examine violence as a social determinant and how violence against Aboriginal women can act as a factor in many other health concerns. First, we will look at depression and how violence is a social determinant of depression. Let's start with a brief definition of what depression is. True clinical depression is a mood disorder in which feelings of sadness, loss, anger, or frustration interfere with everyday life for periods of a few weeks or longer. Depression is one of the most common types of mood disorders affecting the general population. There are many different types of depressive mood disorders, including manic depressive illness, also known as bipolar disorder. There's also postpartum depression, and lastly, there's clinical depression, also known as unipolar disorder. This is the most common type of depression. There is often a misconception that depression only affects the mind, but in actuality, depression affects the entire body, and much like many other mood disorders, depression is a very real illness that can have serious and sometimes fatal results. Some physical symptoms of depression can include fatigue, stomach pains, or muscle and joint pains. Other symptoms include agitation, restlessness, a dramatic change in appetite, difficulty concentrating, feelings of hopelessness or helplessness, feelings of worthlessness, self-hate or guilt, becoming withdrawn or isolated from society, trouble sleeping or excessive sleeping, and lastly, thoughts of death or suicide. The prevalence of depression in Canada is quite high. In 2001, 7% of all Canadians suffered from depression. However, this number is believed to be much higher due to unreported cases. Women have a much higher rate of depression, nearly double that of men. Statistics indicate that 1 in 5 women will develop clinical depression at some point in their life. This ratio is much higher in Aboriginal communities, with women being 3 times more likely to develop clinical depression than men. Not only are Aboriginal women more likely to develop depression than men, but statistics show that depression is more common in Aboriginal women than the entire Canadian women population. In a survey conducted by the Canadian Women's Health Network, 18.4% of Aboriginal women reported feeling depressed for 2 or more weeks in the year prior to the survey. This number is substantially higher than the 9.4% of Canadian female population that experienced depression. Depression can lead to a number of different complications. Suicide is one of the more severe symptoms of depression. Statistics show that suicide rates are consistently higher for the Aboriginal population than the Canadian population as a whole. Aboriginal adolescent women are 7.5 times more likely to commit suicide than all Canadian women. Also, female of Aboriginal descent between the ages of 20 to 29 have a suicide rate that is 3.6 times the rate of all Canadian women's suicide attempts. Many studies have correlated the higher suicide rates in Aboriginal women with the high violence rates, as suicides are significantly higher in Aboriginal women who are survivors of physical and/or sexual abuse. A relationship with violence and depression is also established by many studies, indicating that violence stems depression, which leads to suicide. This is solidified by statistics. Almost 15% of women suffering from depression will commit suicide. Furthermore, in a study of 30 Aboriginal women, 15 had a history of depression and 1/3 attempted suicide. Now that we have an idea of what depression is and the dangers, let's look at how violence acts as a social determinant for depression. Vulnerability to depression is determined by systematic discrimination based on gender, race, social class, sexuality, disability, age, culture, and language. Violence is a social stressor and plays a large role in the social class of an individual. Because they are being treated in such a manner, many people suffering from violence will develop a sense of lower social standing, thereby contributing to the development of depression. As mentioned before, Aboriginal women experience violence more often than the general population. As a result, many Aboriginal women feel like they have a lower social standing than the rest of the population. This, along with many other factors such as gender, age, and culture, contribute to depression. Again, the concept of intersectionality can be seen here, as many different factors contribute to the development of depression. Being female, of different ethnicity, which is all considered non-dominant, as well as enduring violent acts, significantly increases the chances of a person developing depressive mood disorders. Furthermore, many studies have identified childhood physical abuse by partner, sexual abuse, and mental abuse as significant predictors of depression. In a study of 164 women who have encountered violence, 28% were moderately to severely depressed, and 11% were severely depressed.
Substance abuse. Aboriginal women often have feelings of displacement and disconnect from traditional communities. They often face violence, substance abuse, low self-esteem, and dysfunctional relationships. The link between violence in Aboriginal women and substance abuse is significant. Aboriginal women who were victims of violent crimes lose respect for themselves. These women also face many health and social related problems such as alcohol and drug abuse. Aboriginal women who sought out help in the community joined a focus group called the Urban Aboriginal Task Force, also known as UATF. One of the participants of this task force stated that we need more health and well-being promotion programs, but they are almost non-existent. We no longer know how to properly care for ourselves because our ways have been diminished and taken away. We have so much violence in our community. There are lots of alcoholism and a lot of misuse of prescription drugs. Even our children are taking drugs and it has become an epidemic. There are multiple intersections between violence in Aboriginal women and substance abuse. Substance abuse problems result from the impact of traumas associated with violent victimization and intimate relationships. Women with substance abuse problems live in poverty and are at high risk of being abused and being homeless. Being abused, accompanied by being homeless, only enhances substance abuse problems. Substance abuse is the most common and clinically significant comorbidity or dual disorder among people with severe mental illness in Aboriginal women.
Until the 1940s, diabetes was virtually unknown in Canada's Aboriginal communities. However, in the last decades, it has reached epidemic proportions. Approximately two-thirds of the First Nations people diagnosed with diabetes are women. This means that Aboriginal women are contracting the disease at a rate roughly twice that of Aboriginal men. First Nations women have over 5 times the rate of diabetes compared to women in the general population. This is mainly due to the fact that First Nations people were forced into a sedentary Western lifestyle, with diets high in fat, sugar, and processed food. Common themes identified in Aboriginal people with diabetes include trauma and violence. Aboriginal people are at risk for being exposed to a wide range of traumatic events and problems. Such events include homicide, suicide, child abuse and neglect, alcohol abuse and violence, and drug or substance abuse. The traumatic experiences of abuse and violence were identified as one contributive factor to poor dietary habits and the corresponding prevalence of diabetes. Exposure to traumatic experiences may further exacerbate the systemic problems related to diabetes, although trauma and violence seem to be a major problem in Aboriginal populations regardless of whether they live with diabetes.
Here's a quick summary of the presentation. The high rates of violence in Aboriginal communities has reached an alarming amount, with Aboriginal women being the largest group affected. 13% of all Aboriginal women are victims of violence. During our presentation, we wanted to stress the idea that violence is a very large problem in today's society, especially in populations such as Aboriginal women. We identified the social determinants of health that affect the prevalence of violence, but we also wanted to stress the idea that violence itself can act as a social determinant of health for other health issues. As a result, it is very important that issues of violence be addressed and eliminated.
That wraps up our presentation for today. We hope you enjoyed it and learned something new, and will possibly use this knowledge to raise awareness to the issue of violence against Aboriginal women. So for today's scholarly discourse, we would recommend you read the following 2 articles, and proceed to answer the following questions. So we ask you to please provide a response as to why violence against Aboriginal women is oftentimes considered less important than violence in a lower minority population such as Toronto. And we ask you to provide a brief comparison demonstrating how Aboriginal women are viewed lower than white women. Something that we briefly mentioned in our presentation is that there is more attention and effort to provide resolutions for violence against white women as opposed to the minority population of Aboriginal women who unfortunately are victims of 3 times more violence than white women. And the second question we ask you to answer are to list some strategic ideas that can be implemented to potentially control and ultimately lower violence against Aboriginal women, which has not already been mentioned. Maybe some new ideas that can be implemented that you think will cause change uh, in looking and analyzing the previous strategic implementations that have been put forth from the government and in Canada and various provinces that may have proven to be successful, may have proven not to be so successful. So it can really range from anything.
We put together a short animation to help conclude our presentation.
Stop violence against women.